Hello, my name is Dr. Ivo Ferreira, and I'm going to do a video for you in order to use the virtual simulator called the EYESI from Hack Stride Simulation in the best possible way. I'm one of the mentors around the world who dedicates his life in order to teach surgeons, no matter at what stage you are, to raise your level to the next level. Okay, so it's important that you understand the machine, then you can take the most out of it. And the first thing we need to talk is about simulation. Simulation is the bridge from theory and what you need to know and knowledge to the operating room. Actually, I will say that simulation should be present at any stage in any operating room around the world, and you should be like an airplane pilot, simulating it all the time. Simulation mandatory 2 or 3 times a year for those things you don't do very frequently. And of course, with people who want to learn new techniques and new things, simulation is the place to do it. Okay, so the first thing we need to talk about is the hardware. The simulator, okay, has this disposition. Okay, it's very important for you to understand. It's a machine that has a table in which you're going to have the head of the patient. Then you're going to have a microscope. Of course, you have a computer that makes possible the simulation, 2 foot pedals, and a screen, a very interactive screen in which you're going to interact with the software as well. Okay, so let's go step by step. Important to take care of the head and, of course, the 3 instruments you're going to have. The place to turn on the simulator is this button right here. Okay, if you press the button, the machine is going to take some time and it's going to give you this screen. In this screen, you can also see if that simulator is connected to the network and with the software. And when it is in green, means that all the information you have in the simulator, you're going to have it in the cloud. You can have in your cell phone all your metrics, and your mentor can also have access to your data and put some curriculums in you. Let's go for the cataract curriculum. Remember that also you can do retina with this machine. But let's go for the cataract curriculum. You are going to have a user and you're going to have a password. And it's important for you to know them. Okay, so in this case, we're going to put a user. We use this, we are in Ophthalmology University, and we are going to have the OU student. That's going to be the user. And the password in this case is going to be easy because we're going to put OU student 1. Okay, and then you log in into the machine. Okay, we're going to go for that in a minute. Why? Because I want you to first manage the hardware perfectly. The first thing is you're going to have a microscope here in which you need to go and put in zeros, okay, in order to see correctly. And then you're going to manage right here your interpupillary distance. It's very important to manage correctly your interpupillary distance. You can also adjust the level, the angle of the microscope, but I strongly recommend that you always use it like this, always like this. And now we're going to see how you're going to approach the simulator to have the best ergonomics. When you have this perfectly, then we need to go to the head of the patient and we can choose if you're going to have a frontal approach or a temporal approach. Okay, you can have those 2 different approaches that are going to change everything, and we're going to see how in settings right here you're going to manage that frontal approach or temporal approach. Let's go with a frontal approach in this case. Okay, and we really need to talk about this. You're going to have 3 instruments that you really need to take care of them. They're very delicate, and it's important that you take care of them very well. And of course, always take care of the cables, like in this case, so they're not mixed. So if you do difficult movement, you can drop them in the floor, and that could be a big problem because they, in order to work, they have sensors inside and rotational sensors. We're going to have a yellow one with an angle. That is going to be mostly for second instruments and inject viscoelastic and many other things. Okay, you're going to have a forceps that has an angle, that has a way how to grab it. So it's going to be a forceps or a scissor. Okay, and then you're going to have a red one that is going to be straight, that is going to be the Phaco handpiece, and it's going to be irrigation and many other things. Okay, remember, so they have different colors, and then you need to put them right here and be very careful when you use them. The other important thing is that in order to work these sensors, as you can see, being very careful with the cables, what you're gonna need to do in the machine, we're gonna talk it later, is you're gonna find holes in the eye. It's gonna be a right eye, it's gonna be a moving eye, okay? And it's very important that before you do a task, you watch from outside, okay? You grab the instrument correctly and you find a hole and you enter, and then you go to the microscope. I repeat, grab the instrument, find the incision or the paracentesis you're going to work it, that it's a hole in the physical eye, and then you're going to enter the eye. And then you go to the microscope so you protect the hand pieces of the simulator. Other important part for the hardware are going to be the two foot pedals. And as you know, we're going to have a microscope with 4 most important, functions: focus, zoom, and an X and Y. And then you're going to have a Phaco machine with position 1, 2, and 3. And you're going to have lateral switches in order to, for example, you can go from sculpting to quadrant removal, or you can have other functions you can choose. And in here, you're going to have reflux as well. Okay, good. So again, important in the hardware, how to turn it in, important to manage the microscope, the head, the instruments, and the foot pedals. Also in the hardware, important that you have a bottom here to control the height of the table. It depends on your ergonomics and your stature that you're going to control the height of the table. So right now, we can also go for the software. As I told you, you have a user, and probably your mentor gave you a course. So you're going to have a curriculum, okay? This curriculum, in this case, is going to have 4 stages, the one we do. And then in the end, it's important too that you're going to have what we call a cataract challenge that we're going to talk about, okay? So in your curriculum, you're going to have these items that are VRMnet. These items are videos that you're going to have in your user in your cell phone. So you can only access these videos in your cell phone, which are great content, and you can see when you're not in the simulator, and they're going to turn green when you see them correctly, and sometimes you pass the questionnaire, okay? So when it says VRMnet are videos, you're going to have A, B, C, and D. And as you can see, you're going to have locks in some of the task, meaning that in order to go to the next task, you need to show sometimes with a score of 50, then 60, then 70, and then 80, 2 tasks in a row, okay, in order to pass to the next task. This is very, very important, okay? So you need to show consistency of performance in order to go to the next task. Okay, very important, as we were saying in the beginning. You're gonna see your courseware progress here. You can download reports in a USB here, and you can have the setting, as we were saying, okay? Either if you want to do frontal approach or temporal approach, and this is something new and very important. Here, the main incision, you can, choose where you're gonna do it. For example, 130 degrees, then paracentesis 1 and paracentesis 2. Okay, so you need to pick in which place you're going to do the main incision. In this case, we're going to do it in 130 degrees. Okay? Very important to also understand the software. In order to understand the software, one of the most important value propositions from simulation is to be able to deconstruct tasks and to be able to have an incremental approach into any task. Okay, but then when you do the task, my favorite thing is to have objective feedback with the score that it's absolutely described in what happened, what went right, what went wrong, and also how to see that in a replay with augmented features in order to see which were the problems or which would you struggle with. So let's do one task with only that objective, with the objective in order to do something and then have the feedback about what happened. Okay? So let's start the task. Again, when you're managing this software, it's important to understand that it's going to be very intuitive. It's a touch screen, and every time you want to go to the next task or advance, you're going to go in the lower right side, and when you want to go back, it's in the upper left. So you put to start the task, in this case, okay, and here, in this task, the first thing, of course, that is important is visualization. We're going to talk now, everything that I'm doing is part of the checklist. Now we're going to talk about what the checklist means. But visualization, it's very important and we need to see correctly, okay? There you go. I'm going to grab the task. Again, the objective of this demonstration is mostly to know how to get the feedback. So I'm going to enter that anterior chamber. Okay, I'm going to enter one of the abstract elements and I need to enter to them in order to change colors. Okay, so I'm doing right things, but now suddenly what happens if I touch the endothelium? Or what happens if I touch the lens? Or what happens if I'm not working with a centered eye and I'm operating with a tilt eye? Or, you know, what happens if I press too much the incision? Okay, and that's very important. And you can see in the upper left part the incision opening if I don't work perfectly with it. You see? It's important to pivot, it's important to float. So here, because I did a lot of mistakes, I want to go to the feedback. So I repeat, always, 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 okay, go for the feedback. Always go to see what happened. It says, look, you didn't achieve the objective, which was to change colors of 20 balls. And if you have any doubts, press the I here. And you can, see what the machine wanted, very explained. Okay, also the efficiency was good, but the problem was we have an odometer and we have a tilt eye working. So maybe you're not very aware of these metrics, but important, remember, you cannot improve what you don't measure. So now you have new measurements in the eye and you can understand how you need to move through the incision and navigate in the anterior chamber. Okay, so the feedback is going to be the most important thing. Always go for the feedback. And also, one of my favorite features is this one that is called the time lapse. The time lapse is going to go for those features and say, okay, you did a mistake here. Oh, you did another mistake there. And you did another, for example, with the tilt eye. So this is the most powerful thing for the human brain to learn something new, fast and efficiently. Okay? I repeat, the most powerful thing of the software is to give you objective feedback immediately and also with augmented features for you to understand what happened and how many points I'm subtracting from your score in order for you to see the importance of it. So the next time you don't commit those mistakes. Okay? Since we are here, also important that if you want other languages, we have Spanish, French, Russian, and Chinese. I think it's very important, if somebody wants to be more comfortable with it. But the power of the feedback is one of the most important things for the software. Again, you're going to advance in the curriculum step by step with consistency of performance, and you're going to go from A, B, C, and D. And if you can imagine, we're actually going to go for very advanced tasks like capsule rhexis maneuvers, weak sonula, auxiliary devices, placing the anterior capsule, even to go to white cataracts, variant cases, and anterior vitrectomy. Imagine the power of you training anterior vitrectomy even before you go to the operating room. So now, just to finish, one of the things we like here is what we call the checklist, and the checklist. We believe that we cataract surgeons need to behave like airplane pilots and have a checklist for everything and have a lot of structure in what we do. So in the simulator, okay, we can have that checklist and automate that checklist in order for you to perform perfectly. So the first thing we're going to say is when you are doing simulation, the first thing is you're going to go for ergonomics, meaning that you're going to have a good chair that you can control the height. You're going to sit back and you're going to put your lumbars and cervicals in what we call the gorilla position. Okay, right here, you need to be comfortable and you need to take care of lumbar and cervicals. You're going to have 90 degrees in your elbows, and this is going to be the correct way to do it. Okay, in order to that, you need to control the height of the chair, and then you're going to go with the 2 foot pedals that are going to be far away, and you're going to get close to the simulator. Okay, then the second thing you need to be aware is which your hands are going to be, and you need to try as much as possible to have 90 degrees in your hands. Remember, I told you always use this angle. So what I'm going to do is I'm going to put a little bit high, and then here I'm going to have the correct hand position. Okay, so the ergonomics are perfect. When we're with the ergonomics, let's go again to the task that we were discussing, and what you're going to find is you're going to be out of focus. Most of the time with the patient, you put your microscope in the correct position. In this case, it's fixed, but you have in the microscope, let's see it. You're going to have the foot pedal in the microscope right here. Sorry, this is the Phaco. And here in the microscope, you're going to have in this camera, I can show you all the functions you're going to have. Okay, you can pick the functions, but you can have focus minus and focus plus, zoom out and zoom in, and you can actually control even the intensity of the light in the microscope. Okay, very, very important in order to control it. You can have even silence light in the operator in the environment, turn on and off. Okay, and when you control the visualization, again, remember, in zeros, interpupillary distance, and focus in the structures in order to see in 3D. After that, it's important for you to know the instruments you're going to use. As I told you, you're going to have a second instrument. You're going to have probably a handpiece, and you're also going to have a forceps. So we need to understand all the instruments we're going to have and all the settings we can use, especially with the Phaco machine. In this case, when we're doing phacoemulsification, for example, I really want you to understand how to navigate the instruments you have. In this case, we're going to have a Phaco instrument in the red. So it's telling you that, it's always guiding you. This is going to be the Phaco. But in the second instrument, you can choose whatever instrument you want. For example, we can have a vertical chop. We can have a safety chopper, which is a sable. We can have an horizontal chopper, or we can have a push-pull. So if you want to change the instruments, you can. When you go to, let's say, a capsule rhexis step, you can also choose between air, trip and blue, VSS, viscoelastic, and cystitome. So you change, like you do a task, and then you can change right here all the instruments and consumables you need. We're going to have viscoelastic, we'll have triple blue, we're going to have, when we're doing even anterior vitrectomy, you're going to have triamcinolone, okay? So every time, feel free in your screen on how to change those instruments and also consumables. But if we're going to go back to Phaco, I think it's important for you to understand also that the other important thing in the checklist that you always need to check and do is your operating room or operating machine. So when we're doing Phaco, one of the most important things is going to be with gravity. So here you're going to have the height of the bottle in order to control irrigation. About aspiration, we're going to have vacuum and flow. If we choose a peristaltic pump, one of the power things is we can switch between a peristaltic to a venturi pump. As you know, a venturi pump doesn't have flow because you only control vacuum, okay? And you can choose either of them. And then you can also choose continuous irrigation when you're starting, but I don't recommend it in simulation because you need to train your foot pedal. And here we're going to choose ultrasound and the types. It could be continuous, pulse, or burst. And here you can have different presets in which you can, save those current presets. For example, in this case, there's going to be hard cataract. I'm going to put a 70 of power, okay, low vacuum and low flow. But for quadrant removal, I'm going to put also high power, not as high as sculpting. I'm going to put a burst mode, and actually I can put a 450 of vacuum and high flow. Why? Because I want the fluidics to make the job here. Okay, I can save that. I can put irrigation aspiration, again, high and high, no ultrasound, of course, and also even anterior vitrectomy with low bottle, low vacuum, low flow, and high cut rate. Okay, so these are going to be my settings, and I can control that in the settings of the machine. Here, since we're going to do, look, we have a temporal approach in this case. Okay, we can change it to a temporal approach. We can, again, in the checklist, we're going to control the first thing we do is ergonomics and visualization. Now I'm better. Okay, and then look, I just want you to see me doing a temporal approach, okay, with this Phaco. I'm going to start doing sculpting, for example, and the fidelity of the machine is going to be extremely high. I'm doing sculpting, okay, I have the correct ergonomics, I have the correct visualization, I'm making decisions, okay, I have a very dynamic anterior chamber. I can even change, look at this, I can even change my second instrument, and I can choose the one I want. And here I'm going to enter, I'm going to rotate, and I'm going to do the cracking maneuver, which is very important. And many people say that it's one of the things that are more challenging in cataract. I was in sculpting, now with the foot pedal, and I can go for quadrant removal, very important, and here I'm going to go to the nucleus, do position 2, a little bit of 3. I don't have a lot of ultrasound, but I have high vacuum, so I am holding that lens. I'm going to go to the periphery, look, and I'm going to do an horizontal chop that it was a little bit superficial, but now I did crack it. I had a collapse of the anterior chamber. Well, careful. This is a very dynamic environment, very important. Again, position 1. I can change my second instrument, and now suddenly I can do vertical chop, which is a very difficult technique too, that I go, look, to the nucleus, 2, 3, 2, high vacuum, and now the chop is going to be in a vertical axis mostly, bang, and look at that, fantastic vertical chop. Being very careful not to traction the sonula in the periphery. Now suddenly, I have 4 fragments, and look at this, look at the reality. Is not even easy to bring that first fragment into the safety zone, because why? Because it's a hard cataract. Like, you need to create the space in order to come. I have it almost there, but I don't fight it. Why? Because I don't want to stress the sonula. Like, I'm creating more space, and there she comes, and 2, 3. Look how careful I am with the settings I have in order to emulsify. If you don't have the correct settings, I can tell you for a fact that you're going to struggle with the pharmacodynamics of that fragment, okay? Look at this, 2, 3, 2, 3. Oh, and it's spinning too much. Be careful in the way, because it's not only about the settings, it's about how you deliver those settings with your right foot or left foot. But look at this, 2, 3, 2, 3. And now suddenly I need Phaco. Okay, so extremely important what I did. I need Phaco. Look at the score, remember, look at the score, what happened. Look at the time lapse, which were the mistakes I did and I need to improve. Now we can actually go back to the settings. Okay, we can put a frontal approach. We can put where the main incision is going to be, paracentesis first and the other paracentesis right here. And here, the last thing I want to show you, which is very important for us, is, well, let's put the first surgical step, is the hand biomechanics, which we really like. Let's put it in the frontal position. And here, we're going to do a capsulorhexis. Look at this. We say that you need a fixation point and the way how to grab an instrument. It's going to be different how to grab a second instrument, and then we're going to do a video from you how to grab a second instrument or how to grab a handpiece. They're going to be different, okay? A handpiece needs a fixation point with the 3 fingernails in the forehead of the patient, but the instrument is going to be more horizontal. The second instrument, fixation point, 3 fingernails in the forehead of the patient, what we call the crab claw, very important. And here we're going to use it this way. We're going to inject viscoelastic, okay? Then we're going to create the first flap with a small cystotome. We enter laterally. We create that first flap, okay? And then look how the way I'm going to grab also the forceps. Remember, fixation point, 3 fingernails in the forehead of the patient. I enter laterally, frontal, then I'm going to grab it, then I'm going to control that capsulorhexis, okay? But what I want you to understand is how I'm floating through the incision and how I'm pivoting. My correct hand position allows me to pivot and to float. This is incorrect, this is incorrect, and this is incorrect, and this is incorrect because I'm moving the eye. I'm working with a heel tie. What I should do is to pivot and to float, and in order to do that, I don't even have to fix the eye in order how to do a perfect capsulorhexis. Okay? We can then talk about specific steps, but if you do this in your checklist, you're going to be fantastic. Okay? All those things are important, and because I'm not doing a good job in managing the incision, I'm losing a lot of viscoelastic, and that's a big problem. So, again, it's a pleasure to be here with you, talking about the power of the simulation, about to understand the hardware, to understand the software and the curriculum you're going to use, but most of all, the feedback, the objective feedback the machine is going to give you, and also, the power of having discipline and a checklist. Okay? Ergonomics, visualization. Okay? We need to understand the instruments. We need to understand the Phaco machine settings, the consumables, and of course, the hand biomechanics. Thank you very much.